The symptoms that I'm experiencing is a high fever, a persistent dry cough, and a bit of a sore throat. So the way that I'm feeling is basically like it's a bad cold or a bad flu. I actually caught COVID-19 from exposure to my girlfriend, who I share a flat with. She caught it from work. My girlfriend was actually exposed to someone who had a confirmed case of COVID-19, and through interacting and socialising with them, she and others became infected with the virus. Comparatively, I would say my symptoms are quite mild. The symptoms that my girlfriend was experiencing was an extremely high temperature. In fact, we weren't able to find a thermometer to find out what it was exactly, because they're sold out everywhere. Difficulty breathing, body aches that were so bad she couldn't even move, and a very, very persistent dry cough. So all of these things are basically all of the things that we've seen from the health minister, from the TV and the government, that display symptoms of COVID-19. So effectively, she's too sick to actually do this interview. Since we've both been exposed to COVID-19, we've both had to kind of rely on a couple of things. The way that we're treating ourselves is, basic painkillers like paracetamol to help the fever, staying away from ibuprofen, because there's a lot of media coverage on how ibuprofen can actually be counterproductive to the symptoms of coronavirus. But we are having some difficulty in that the way that we need to medicate ourselves kind of conflicts with what we're being tasked to do by the government by staying indoors, because we need to go to the shops and buy paracetamol because we're running very, very low. And then when we go, before we went into self-isolation, I went into the shops and there was the medicine part was absolutely bare, as was the toilet roll part. So we have a very small amount of paracetamol. In fact, we've had to rely specifically on friends of ours who live close by, who are doing social distancing, but not specific self-isolation, we've had to work out a process of them doing us a huge favour of going and finding us paracetamol and other medication that we're using, and then leaving it on our front door. So there's no actual interaction, there's no contamination that way. And that's effectively how we're getting the medicine. Another thing that was notable with my girlfriend's symptoms is she was having a very, very tight chest and having difficulty breathing. And the advice that we were given was to call 111 to ask for some specific help with that, because that was a particularly bad symptom of COVID-19. So the advice, after being on hold for a very, very long time with them, eventually they actually sent an inhaler, which is a blue asthma inhaler, to a nearby pharmacy. Now, that in itself also came with complications, because I'd been exposed, I was showing symptoms, so I have to stay home also. So there was no way of us actually getting the asthma inhaler to the house to help her with her breathing without help. So obviously in that particular instance, I had one of my very close friends who lives nearby. He'd had to go and pick up her prescription, bring it to our door and leave it outside. I mean, the main concern is not my health at this point, whilst I am worried about that. I still have a high fever. I'm still coughing a lot. I still feel generally very unwell. However, my main concern is not my own wealth. My main concern is actually not spreading it around anywhere else. The reason being, this thing is so infectious, and the worry is that you're going to pass it on to someone else, who could then pass it on to someone else who could potentially die from it. You hear about the people that are high risk, some of the elderly, and that's kind of the main worry, rather than my own health. So I don't buy into the hype so much that this is going to be really, really bad for your health. I'm actually much more concerned about passing it on.